Well, good morning, Team NeoMed. Thank you again for the opportunity to spend a little time with you on this fine Monday morning to give you an update on some of the progress taking place at the campus and with individuals across our community. I hope to keep this relatively brief and spend more time answering questions for you today, but I'm going to share with you what it is I know so far. And I'm going to start with the concept of return to work. We've been working very closely with the Inter-University Council. This is the group that represents the 14 public universities across the state of Ohio, and getting a better understanding of how others are starting to sequence in back to campus while at the same time ensuring the safety and the health of our community. We've gone very slowly. As you know, about 2 weeks ago, we started bringing back members of our community that included our police force, who had really maintained a presence the entire time, increasing the total number of individuals who represent our operations team, who maintain the physical campus on NeoMed, as well as researchers, and allowing researchers now to come back with up to 2 and even possibly 3 members of their research team if they believe they have critical research that must be accomplished in order to further the work that they've been performing and to stay competitive with federal grants. It was a rather slow return that's taken place. Despite having the opportunity, many of our researchers judiciously decided that their research didn't quite qualify as critical, and so they slowly started to come back into the campus setting, and they've been really outstanding with following the 6-foot social isolation rules, with utilizing face masks and hand hygiene. In addition, they've been performing daily screenings and ensuring that they've taken their temperature and that they are not coming to campus if their temperatures are greater than 100.4 degrees Fahrenheit, or if they have any new onset of respiratory symptoms. We've done a lot of monitoring of this, and I really want to thank those individuals who have followed all the rules and ensured that we have enhanced campus safety. In fact, to my knowledge, and we do track this, we have not had any additional concerns for COVID positive employees on the NeoMed campus. So I think what we're doing is working, and we're doing a very good job at it. We are approaching the fall semester, and as the fall semester starts to unfold in front of us, it's important to remember that unlike some campuses, our fall semester does not begin in September, and in fact, it begins in late July. And as part of the rules that have been implemented by the state, as our out-of-state students come in to participate on campus, or state-based students who've taken time to live away on vacation at family members' homes, we do have to observe a 2-week quarantine period for all of those individuals. That has not changed. That means we will very likely need to have students back on our campus as of about July 10th, which means we need to be prepared for them. We need to have the dorms prepared, we need to have programs ready to go, and we need to have employees on campus who are critical to interacting with our students here and preparing for all of those activities. That means we're going to be entering into the next phase of bringing our team back onto campus as of about June 1st. What are we waiting for? Well, we are currently working on a list of those individuals that we're going to be sequenced in first. We are ensuring that all of our processes and procedures are in place and have ways to monitor those effectively to ensure they're being enforced and that they are effective. Dr. Joe Zarconi has been our representative to the IUC team, who is putting together a list of ways that universities can most effectively do this. Although it is not written for any particular university, it understands that all of us have nuances, so it won't be applied uniformly, but it will be applied in a way that is going to ensure the health and safety of our community as much as we possibly can. I think it's important to remember that we went into the shelter in place process essentially overnight, really ramped up virtual education, delivered on our mission, and it was done in a nearly seamless fashion. Bringing us down from that and returning to some sense of new normalcy will not be as easy. Many of you are going to be anxious and concerned about the way we do this. Please understand we are doing everything we can to make this a safe transition. The intent of the shelter in place was not to prevent all of us from eventually becoming exposed to COVID-19. Chances are, unless a vaccine is developed, that we all, or at least a large number of us, will be eventually exposed. And we don't know when that vaccine is coming. What it was intended to do was to flatten that curve, meaning we don't want everybody coming down with it at once. Therefore, we would overwhelm our healthcare systems, and people who came down with the disease would not receive optimum care, and we would have increased numbers of people experiencing catastrophic outcomes. That is now over, at least for now. Our health systems are operating well. There are substantial bed capacity, there's ventilator capacity, there's ICU capacity. Our measures have worked. So now we're very cautiously coming back, observing what experts believe to be very effective in keeping that curve flattened, and that is social distancing, mandatory use of facial coverings, hand hygiene, and symptom monitoring. In addition, there are new measures going into place for contact tracing. And what that means is tracing you, individuals, and where you've been to tell you if you've been possibly been exposed and could be at higher risk and potentially will need testing. I've been asked if NeoMed is going to do broad testing of all individuals on campus. Currently, there are very few tests available for antibody testing, and if it were, I think that would be one to consider. However, we don't know that antibody testing means anything at this point. You could have antibodies, but it doesn't mean that you are immune or that you are going to be able to prevent transmitting the disease to anybody else. So at this time, it's not recommended that we do this broadly. Others have suggested that we test people who are asymptomatic routinely. In fact, it was brought up at the IUC that some other countries are testing every student every day. We looked at this possibility, and the concern with that is, first, given the average cost of testing, if it were available broadly, and it is not, it would run NeoMed about $40 million a year. We would not be able to survive. We would not be able to educate, complete research, or have anybody on campus. Additionally, these tests have false negative and false positive rates. And if you look at the rates that the test is wrong, and we tested you every single day, we would wrongly tell you that you had or did not have the virus approximately 21 times per year. And therefore, we would put you in isolation if it was a false positive, or we would allow you to continue to be at work and spread it if it was a false negative. So unless things change dramatically, this really is not a good solution for us. We are waiting for guidance from the CDC and the federal and state government on how they would like us to move forward with that. For now, what we have is social distancing, masking, hand hygiene, symptom reporting, and doing everything we can to ensure that we don't spread this virus. Some experts have looked at these recommendations and believe that they're implemented appropriately, we reduce the chance of transmission by up to 95%. That 95 is what the 95 in N95 mask stands for. It's not 100% protection. These masks that people have not been able to get because they've been in such high demand, it reduces your chance of about 95% of viral particles from contaminating within the region of the mask and getting you infected. So overall, these are really good measures, but we have to follow them. We don't have the information to give you right now on the sequencing of coming back in. We have a team working very diligently on this and hope to have those available to release within a week. We'll also identify who will be coming back and how we're going to maintain your presence safely. We do have students that will be coming on campus, and we are going to offer a hybrid model when the students do come. As you know, we have a large collection of lecture halls and small classrooms at Neomed. At issue is the larger classrooms, which can hold 200 to 350 students under 6-foot spacing rules, now can hold somewhere between 40 and 50 students. We won't be able to offer all classes in person. However, our students do have mandatory training in laboratories that can be done in small groups, following all of these safety guidelines. And we have small classroom participation that can use the large classrooms and maintain the distancing guidelines. Many of our younger members of the population don't always feel that they are at as much risk as others. And it's hard sometimes to quite understand that risk. So we're going to ask them all to sign social contracts, indicating that if they're coming onto our campus to be part of our team and our population, that they will abide by these rules, recognizing that the rules aren't necessarily there for their protection, they're there for everybody else's protection. So we are working hard to ensure that we have solutions in place, both processes and procedures. Our police force will be actively monitoring the situation on campus, but they can't be everywhere all the time. And we ask all of you who are eventually back on campus to spend time monitoring and reporting if you see something take place that violates the protocols and is unsafe. When you do so, you're protecting everyone. So we thank you in advance for any input you can offer on how we can be more effective, but also for helping us to enforce. Next, I want to talk a little bit about budget. I've shared with you that the state subsidies to the university, which really help support a substantial amount of the work that we do, for the last 2 months have been cut by $900,000, approximately $900,000. We've also lost revenue in other areas as we've shut down many of our auxiliary services. It appears that that's likely going to be about $1.5 million in total losses, in addition to the $900,000 from the state, which puts us about $2.5 million for this fiscal year, which ends on 30 June. I think we make up a great deal of that through cancellation of events, the fact that we've not been traveling. There have been a number of things that allow us to recoup most of those savings. And so I don't see that we had anything substantial that we had to do that's impacting any of our team members for this fiscal year. I shared with you we're expecting a 20% cut in our financial support from the state for the next fiscal year. We've worked very hard to tear apart our budgets, meet with each of the vice presidents, the deans, and senior leaders to figure out how to reduce their budgetary expenses from a non-personnel standpoint, meaning not affecting people's paychecks, in order to keep our team as whole as possible and reduce expenses to get us through this next year. I think we've done a very good job doing that. And as I shared in the past, there are going to be some areas that we all have to share in, specifically around benefits. While we're not intending to decrease any salaries at this time and not planning any large layoffs or furloughs or massive salary cuts, as has been done at the other universities, please understand that this is an uncertain landscape. And as much as we're doing everything we can to protect you and to protect your employment, if things change outside of what we know now, we may have to reset. If there's a second surge, and if that second surge mandates closing the university for next year for any on-campus experience, then we'll have to revisit that. But for now, I think we've done a very good job. While we won't be able to give people deserved raises for the great work that they've done, our intent is not to cut salaries. We will have to make some modifications, as I noted, to overall benefits, but those have been structured in a way to be fair so that the number of our employees who are on the lower pay tiers, especially those less than $75,000 a year, should not see any type of cuts whatsoever. If they are, they would be exceptionally minimal. Right now, my intent is that there will be no cuts to that employee population. And as we escalate up to the higher tiers, it will also increase the amount that we have to give over time, so that those in the highest tiers will be the ones taking the largest brunt of the impact, but still meant to be very reasonable and not to have dramatic impact on your overall financial situation. This is what we have to do. We have to unite. We have to come together as a team in order to protect the university's sustainability and protect the members of our team and their livelihood. I think we've done a very good job, as I said, doing this. It does mean we're going to tighten our belts. We have to tighten our belts for the next year. That includes a substantial reduction in travel. I've asked our team to reduce travel by a minimum of 70%. That includes the president's office all the way down to the different departments and divisions. While travel is a nice option for building relationships and attending national events in science, in part of what we do, I truly expect that those are going to be canceled broadly across the board until at least December, if not well beyond. So in reality, I don't see that it's going to have a big impact. Otherwise, I've asked our leaders to reduce overall non-personnel spending otherwise by 5% at minimum. This means we'll have to do well by reducing things like copying fees, memberships in other societies, these types of things that they're niceties, but they're not absolutely critical to what we do as an organization. We are going to have a budget that's been finished for proposal, accomplished within the week, and this will go before our Board of Trustees for approval. Our Board of Trustees, led by Mr. Paul Bishop, is here to provide a second set of eyes to ensure that what we are doing makes sense, and of course, to gain their approval before we are permitted to move forward with it. They are a very supportive and important part of our organization, and they are here to look out for our long-term sustainability and for the members of our team. And I know that we can all count on them to give this a really diligent second look and to make suggestions where we could either do a better job or to approve this to allow us to move forward. If we get to the position where the uncertainties push us in a negative position, whether there's a recurrent surge that shuts us down in the winter and in the fall, or the government finds that the financial crisis is so dramatic that they have to come in and reduce our subsidies from the state even more, then we will work very closely with our Board of Trustees, again, to figure out how we do that to be able to move forward. For now, though these are tough times, I feel very good that Neomed has done an excellent job in protecting the team and protecting our mission to effectively operate as a university going forward. I do want to recognize that there are members of our team who've continued to do great things over these tough times. The College of Medicine, the College of Pharmacy, the College of Graduate Studies, our HR team, and certainly our IT team, police force, and operations team have been just amazing. Our advancement team has continued to move forward. They've raised additional dollars to help support our students, faculty, and staff who've been affected by COVID-19. And then our marketing and communications team has been just absolutely spectacular with sharing the information, sharing what the university is doing with you to try and optimize communication, and sharing the great stories of those who've stepped up to do even more during these very difficult times. It was shared with me by Dr. Young that one person she really wanted to ensure was recognized were the efforts of Mr. David Rubel, who has done so much to ensure that our students are going to be back into the clinical setting by most of them by June 1st. This required a tremendous amount of effort at a time where things are very tough getting into the clinical setting, knowing that we are putting ourselves at somewhat increased risk when we're there. That's part of what we signed up to do as physicians and pharmacists, taking care of patients, but in a way that we're mitigating the risk as completely as possible. Our health systems were appropriately nervous and are uncertain about these times also when they had to remove our students from the clinical setting to ensure the safety of patients, the students, and their staff. They are now working to be able to ensure that they're back, because without that opportunity, we cannot create the physicians and pharmacists of tomorrow. Those who will be stepping out, potentially still in COVID times, but certainly stepping out in times when other pandemics may show themselves and come forward into the clinical care arena where they'll take care of us and our families and our community. So we are absolutely obligated to get them appropriately trained and ensure that they are competent and safe practitioners for our healthcare environment. With that, I'm going to stop and open it up for questions.
First question, will all students need to be quarantined or just those returning from out of state?
So currently we are only following state guidelines. It will only students who are coming from out of state or students from our state who elected to go stay with relatives or others outside of the state for a prolonged period of time. As you know, the governor has made an exception for people who work consistently or as part of their work have to leave the state and come back. But otherwise, it's following state orders that everybody at this time will have to be quarantined.
Some individuals have a hard time wearing a mask for long periods of time. Will it be required when we return to work? Is it mandatory in our individual offices or just when we're outdoors and on campus?
No, our current policies, which will continue, are if you're in an office, closed door office, that you can be in there alone without your mask. That's unnecessary. In fact, I've been in my office at the university numerous times over the last several weeks. And when I come onto campus, the first thing I do is put my mask on. When I walk into my office, I close the door and I take my mask off. When I meet with people in my office, I have put my mask back on again, and they've come in and put theirs on also. That's following state rules. I'll tell you that I understand the discomfort wearing a mask. As a surgeon, I'll do long cases and wear masks throughout the entire time for the safety of the patient, and it's comfortable in that setting, but I'm in a cooled room generally. When I'm in my office, it is not so comfortable. And so I've actually been more prone to holding meetings, even one-on-ones on Zoom, even while I'm still at work. And I think we're going to continue to use these type of virtual meetings more effectively, even when it's between people who work on campus.
If you believe you may have had COVID early in 2020 without a formal diagnosis, should you seek antibody testing through other means before returning to campus?
No, I would say you should speak to your physician and ask their recommendations based on your unique circumstances, because it's different for everybody. However, if you were sick more than 2 weeks ago, more than 3 weeks ago, and you're asymptomatic now, we're going to make the assumption that you had it and that you've cleared it. You're completely asymptomatic now, following CDC guidelines on wait periods after last symptoms, and you should be safe and fine to come back to campus. You should not be infectious. So if you're talking about back in January and back in February, and you've completely cleared the disease, unless there's something about this disease that we don't know, you should be completely safe.
Thank you, Dr. Langell and the executive team for all your hard work. Will health shields be installed at the main reception desk and other departmental reception desks?
So Dale Luch has been working on putting up barriers for best practices. I have not seen the final plan yet. We are still working on it. But in areas where it makes sense, we are looking at putting up plexiglass barriers, yes. The other options are ones that we've volleyed around and we're still deciding on. If you look at the main reception desk, that door does not have to be opened. We can put a type of virtual communication right outside so you can see the person who's giving you the information, and speak to them directly, and only if it's necessary to come in contact with each other to be able to do that. We have to continue to monitor this day by day. And that experiment is taking place, as I've shared every time we've spoken over the last few weeks. We know that the state is opening up one-on-one contact, masked one-on-one contact for haircuts, for tattoos, for piercings, for massage therapy. We are already opened up for outdoor dining, and indoor dining, I believe, opens this week. So we're watching much more close contact than we're going to have at our university take place now. We believed that it was going to be a 2-week period at most before we saw whether there was going to be a need to backtrack. And if we do, we will backtrack based on the state requirements. But so far, that really hasn't shown itself to be the case here in Ohio.
What decisions went into make White Coat for the incoming students virtual? Will this be rescinded if more information becomes available?
That decision was made by the college teams. We originally planned to do them in person, understanding that we likely were going to have, well, we would have a pivot plan in place, not necessarily likely, but as time got closer, the thoughts were we were probably going to be in a position where it became more likely that we either had to delay it or we had to go to virtual. Dr. Young's team for the College of Medicine decided that delaying it wasn't something that was feasible because the students needed to have their coats for some of the early clinical training experiences that they would get. And rather than putting a lot of effort into preparing for something that they felt was very likely not going to happen, they planned to have the virtual event take place. I don't know for sure at this time whether she's or Dr. Kazmer have decided to have an optional opportunity for in place, but my understanding is for now not, that they're planning completely virtual for this year. It's an adaptation that we'll have to make. I realize it's an adaptation that affects our first year students coming in, but much like our graduating fourth year students who also had to have virtual match day, virtual commencement, virtual award ceremonies, the reality is it turned out to be outstanding. And in many ways turned out to be better than the way we've formerly done this in person, because we were able to individualize it, engage families into the situation even more closely. And I believe that's part of what's been planned now with White Coat, that if you have family members around during a virtual, you'll be able to have your family members don your coat instead of a faculty member who, for our students coming into the first year, is unfamiliar with and probably means a lot less to them as far as providing an individualness and making it more special.
How will the bistro, cafe, and Erie Island support many who rely on them for lunch needs when we're all back on campus?
So we are making plans currently with our partners who help run those organizations. What we're doing is following state and IUC guidelines. And so that means our intent is the bistro will be open, but it will be providing pre-prepared boxed lunches. So it'll be grab and go, same quality food that you've been used to, but rather than coming in, getting in close quarters, ordering, and then eating in the area, you'll be coming in, grabbing the food that you want, paying for it, and then leaving to find an isolated place to sit so that you're not closer than 6 feet with each other. And we know masks have to come down to eat, so we're being very cautious about that. Fortunately, in the summer months and in the early fall, that will give you the opportunity to eat outdoors where there's far less of a risk of transmission than there is with indoor spread because of the air handling systems.
Does the university have pay transparency with the impending benefits cuts?
I'm sorry, can you repeat that?
Does the university have pay transparencies based on the benefits cuts to
Pay
see
transparencies.
who's going to be under that $75,000 threshold?
Well, I think the people who are under those thresholds know who they are, and we are not in the business of sharing your salaries with each other. That's a privacy piece. There are ways through the state that those can be accessed, but for us as a whole, that is not something that that feel that would be a violation of people's privacy for us to just say, here's what everybody makes. But you know who you are. We're going to tell you exactly what the guidelines are on those cuts, and you will be able to monitor for yourself whether it's taking place. We really have gone out of our way to make sure that those lower tier earners are not going to be impacted. And as you start to escalate up, even those who are in the $100,000 a year range will not see nearly the impact of some of those who may be a little bit higher.
How should faculty who rely on professional development funds to contribute to promotion and tenure continue to remain on track for their next professional steps, specifically those who are non-tenured track and do not have substantial dedicated percent of time dedicated to research / not funded research funding?
Yeah, so two things. One, the traditional opportunities that people have had in the past to attend development conferences, for me, would standardly be go to American College of Surgeons meeting, present papers at those types of meetings. Those meetings aren't taking place, first of all. Second, we do have to make the cuts around those types of opportunities for this fiscal year coming up, which reduces travel. It reduces the cost of the registration, which in many of these meetings can be quite expensive, anywhere from $800 to $1,200. And instead, what most organizations are doing is moving to do these on Zoom type platforms. So you still interact with your colleagues, you still learn from each other, you still present posters and papers, but you do it in a far more cost-effective manner. In addition, the university is ramping up a faculty development program here on campus. We are going to do this as a group. I'm actually taking the faculty development component and building that more robustly under the Vice President for Academic Affairs. You may or may not know it currently sits under the Vice President for Health Affairs. However, it makes sense to put it under Academic Affairs, and we will still be able to invest in that. I want you to understand, as the university is making cuts, if we were to just cut and not be careful and thoughtful about the way we do this while still investing in our faculty and our staff and our students, we would spiral to the point that we're not offering value. So we are making cuts, but we are not cutting everything that we deem to be critical. And we are actually planning to invest more in some areas. Faculty development is one of those areas where I firmly believe we need to invest to help our faculty be more competitive for grant opportunities, to make our faculty better educators, especially under the new training programs that are being developed that involve peer-based learning and teaching in a different way, utilizing the multimedia platforms that we've created to provide a better learning experience. Those will be developed, they will be implemented, and they'll be ready to go for our faculty in the beginning of the coming fall semester. This will include leadership training for faculty who look to go into that pathway. So it's really about making you better at all components of what we do: leadership, service, education, and research. We need to grow your capabilities so that you become better, more supportive, and more productive members of NeoMed, and then we all win.
If we need to be traveling out of state for any reason, including personal, should we be isolating / working remotely for 2 weeks after, provided we are back to on-site working?
Yes, we're going to follow the governor's guidelines on this. So if the governor feels the state is in a position where we don't need to do that, but that you just follow the standard protocols that have been put into place, then that's what we'll do. Currently, though, the governor's guidelines would say that you do need to quarantine if you're out of the state for an extended period of time and it's not part of your standard business operations, which he's made an exclusion for. So then, yes, that is exactly what you would have to do. And you would need to get that cleared with your supervisor. That means you'd be taking leave time. And the supervisor is going to have to look at what that impact is. So if you have a critical position and you are absolutely necessary here on campus in order to deliver on our education needs, or it would greatly slow down the research progress of a team of individuals. Your chairman or your supervisor should have that discussion with you to say, if you were to take leave right now, it would dramatically impact so many others in the university that they just would not authorize the leave at that time. This is something we're going to need to be more diligent about on how we go about authorizing specific periods of leave. However, if it makes sense for you to take your earned leave to go off and spend time, and it's not going to have dramatic impact on the rest of the university, then you should do so. And when you come back, you would expect that you're very likely going to have to be in quarantine. Now, how we deal with that in the future is something we're going to have to look at very closely because in a sense that could turn, you'd have to be able to continue to do your work from home, right? Otherwise, those additional 14 days mandated by the state, not mandated by Neomed, might become unpaid leave. So it's really important that we do this and work together to ensure that if any quarantine period were to occur, that we can continue to keep you productive.
What will be the mask requirements for those in cubicle settings or shared offices?
The mask requirements are going to be exactly what's been laid out by the governor, and that is face masks. Not medical grade masks, but wearing of face masks. We just don't have any other opportunities in place right now. Even if we put up plexiglass barriers higher around cubicles, you're still really quite close to each other. So our best opportunity is to separate each other as much as possible. Supervisors can work to isolate individuals a little differently than we have before so that you have an opportunity to remove those masks.
How can individuals report violations of safe practices?
So this is something that we're still working out. We're going to have to work with as a hotline number, emails, texting. We don't want you to necessarily put specific people's names in there, right? Because that becomes a little bit difficult. And then we worry about retribution or individuals who may use this inappropriately. What we'd like to do is have you be able to contact somebody from either the operations team or the police force who then can come into the area and make the enforcements.
What about employees who are high risk? Are we still looking at a June 1st if they're essential?
I would say that if an employee is, it depends on how you define high risk. So if you are somebody who's 65 years of old, which is considered an increased risk category, then the maneuvers, if it requires you to be in place for us to step up, getting our campus back to full functionality for our students, then yes, the intent is you'll be back on campus, but we will completely reduce the risk as much as possible through these maneuvers that we've put in place. And these are the same risks that you're experiencing going to the grocery store, going to the pharmacy, doing things you're currently doing daily. Otherwise, the university just won't be able to be sustainable. And if we can't carry out our mission, then we're not able to operate. And if we're not able to operate, we really can't keep anybody employed because we won't have the dollars coming in to do so. So it is going to be a little bit difficult. We're going to have to make some tough choices.
When will airflow be reestablished into the offices/buildings on campus?
I will tell you that I didn't know airflow wasn't established. My understanding is that airflow is continuing. Dale Hluch's team has been continuing to maintain the operations of the university. If I'm wrong on that, I will stand corrected by Dale's team, but my understanding is that we are still continuing to operate the ventilation systems. We have, I believe, reduced some power utilization for maintaining temperatures at particular levels in the university.
I think the question would be, are they adding fresh air into the circulation opposed to redoing all the air?
Well, our air handling systems are far superior to the ones that you would have in your homes. They are commercial grade, but they are not handling air at the same level, say, that a hospital would. We follow state federal regulations, which requires a substantial turnover of air on an hourly basis within every portion of our university facilities. I'm not the engineer to be able to give you a lot more details than that, but I'll certainly talk to our ops team and we'll get the information out to people if it's something you're interested in.
As businesses are limiting the number of individuals in areas at one time, is Neomed doing the same? For example, the number of individuals in the bookstore, the 24/7 area, or other public areas on campus?
Yes, that will be part of our rollout plan. In fact, we've already done this. This has been taking place on campus now, and I'll tell you, we have had to deal with inadvertent violations. So we've had to put engineering controls in place to make that happen. Over the course of the reduction in number of people on our campus, we have continued to allow students who absolutely need access to the internet to continue their education that do not have it otherwise to come onto the campus. What we found is that some students working together were getting closer than 6 feet together and not wearing masks. So we've counseled them, but found that the best solution was to put engineering controls into place, meaning if a table was out still in the atrium areas, we left one chair at it only. We separated chairs so that people couldn't congregate. So these measures are in place now, and we will continue them, track them, and be very diligent about them. We very likely will reduce the number of total population of people who can be in closed spaces. We already have those rules set forward by the state. But if we start to see people getting too close, for instance, in the bookstore, which in our current bookstore is hard not to do because the limited amount of space, we will put in instructions, signage, and then floor markings to help enforce that.
Final question. How should someone handle the out-of-state quarantine time of 14 days if you have a family member that needs your assistance, for example, elderly parents, and also for summer vacations?
Well, these are decisions that people need to make. And so if coming here as a student to start your educational endeavors means you have to give up the last 2 weeks of your vacation, then that's a decision that you're going to have to make. This is a state law. This is not a Neomed decision, and violation of state law carries pretty significant ramifications. So I don't have control over that. And if they want to be part of our Neomed community and they're out of state, this is something they're going to have to do. As far as taking care of elderly family members, they're simply delaying that or making it happen 2 weeks earlier. They need to be able to prepare for it, which is why we need to have this in place now so that we can tell them, here's how it's going to take place. You need to be prepared for that quarantine. We need to communicate with them while they still have about 5 to 6 weeks to be able to make those preparations. Remember, as they leave, their parents or family members you're referring to are going to be without them. So it's just going to happen a little bit sooner, but it's what we have to do. It's state law.
Final question that just came in. What about small group study rooms in the library and GE Commons? Will they be reconfigured?
Yeah, we are reconfiguring those. And so we've done things already. For instance, communal keyboards in the library have been shut down. We feel that's too high of a risk. Even if you're separated, if somebody uses it, didn't wash their hands, then comes on, and again, most of us wash our hands, but we need to look out for your safety and ensure we're being as conservative as possible. So those have been removed. We've already re-engineered many of the seating and the table to prevent that from happening, and we will ensure that those types of engineering controls are in place. It's really about your health and your safety. When we ask you to do something, it's not just for you, it's for everybody in our community. We have to be part of a team. And if you see somebody who is not abiding by these protocols that have been put in place for all of our health and safety, then by not saying something, it's not you saying, feel free, you're putting yourself at risk. You're actually putting everybody else at risk. I actually think that we're not going to have a substantial issue getting compliance. It's going to be much like smoking, right? Smoking is one of those things where if you're doing it in a place where you shouldn't be, everybody's pointing it out. And there is a power in the group of us coming together socially to say, this is not acceptable. And you need to abide and follow the rules, because it's not your health and safety, it's our health and safety. Thank you to all of you. You really have been just outstanding in helping us get through these very difficult times. And I truly understand the anxiety that this causes, the difficulties this causes for everybody. And it really is harder re-engineering the comeback than it was for us to do things differently very quickly. And that was difficult also. So thank you, everybody. I look forward to speaking with you again next week. When I have more information, we will get it out to you in detailed form. For now, we are working very carefully to ensure we open up campus operations for our incoming students, but in a way that is as safe as possible for all of you and all of us in the community. Have a great day.